As Aaron mentioned, I'm Shreela Palit, and I'm here in Jacksonville. And usually I have a meeting during this time, which is why I haven't been able to join you guys. But I'm really happy to be here today and talk to you a little bit about my research. So I'll be talking about looking at resilience in emerging adulthood, specifically in those who have chronic pain. And some of you may know about emerging adulthood, kind of a newer term, but really referring to adolescence and young adulthood, that transition period from pediatric to adult healthcare, as well as a lot of the kind of psychosocial, biological, and environmental changes that happen as we become adults. And I'm new to blue jeans, so I'm just trying to figure out. There we go. All right. So almost 17% of adults who have chronic pain actually note that they began having pain for the first time in childhood or adolescence. So clearly it's something that persists throughout the lifespan for a lot of individuals with chronic pain. And specifically, chronic musculoskeletal pain is the most pervasive form of chronic pain, really worldwide, across populations, and it's especially true for what we call late AYAs, or adolescents and young adults. And there's a lot of physical and psychosocial functioning disturbances that can happen, and these can go into later adulthood as well. Things such as difficulty finding employment and interruptions in relationships and other areas of life. And about a third of individuals grow up with pain that continues into adulthood. However, there is a small subset of individuals who demonstrate improvement or even resolution of symptoms. And so some of the questions that I've asked are what allows some of these AYAs to be resilient in the face of pain and be a part of that subset that doesn't have this persistence of pain and disability? And how can we identify these factors to actually inform our prevention and treatment strategies? So as many of you likely know, that resilience in a nutshell is a process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. So you can almost visualize it like on a balance, as you see here, where even though there is a presence of adversity, there are these protective experiences that can actually outweigh the impact of these stressors. So with this ability to bounce back and effectively recover from stressful circumstances, it makes sense that we'd want to look at this in the context of pain, because pain is stressful. So why not, examine this a little bit further? What makes people able to bounce back when they're experiencing pain? Interestingly, though, pain research as a field has really just looked at what makes somebody vulnerable to pain. So what are the risk factors, kind of the negative aspects of pain. And a very small amount of literature has actually looked at positive and adaptive factors on pain and functioning, like resilience. And the few that have looked at resilience have really looked at just psychological resilience. And I'll talk about that in a little bit, that there is resilience that can be found across systems, not just psychological resilience like hope and positive affect. There's other factors that we may be missing if we're just focusing on one domain. And all of this has a clear impact on pain management. And why that is traditional approaches are kind of the problem focused that you see here, that again look at how do we reduce deficits in someone? What's wrong with somebody? How do we make them less vulnerable? And a lot of the things that we focus on in these traditional approaches are things like reducing pain and disability, reducing something called catastrophizing, which is really thinking worst case scenario, like this pain is literally a catastrophe and it's never going to get better, and other things like low mood and depression. However, if we start focusing on resilience a little bit more, then we kind of go from a problem-focused direction to a strength-focused one. So that way we can start focusing on how do we enhance an individual's well-being? How do we look at the strengths that they already have and boost those to foster growth, optimism, and self-efficacy, things that would allow someone to potentially fare better when facing a chronic illness like pain. So there's specific challenges on top of this for emerging adults with pain. And so again, it's this formative developmental period that has so many different types of changes, individuation, trying to create autonomy for themselves, differentiate from parents, things like this. So in addition to navigating these unique life challenges, changes, and role changes as well, this is even harder if you're also trying to manage a chronic illness. And so it's a good time to really foster a lot of healthcare independence and advocacy for these young patients and to help with that transition from pediatric to adult healthcare. But when we look at pain management, it's virtually non-existent in terms of services across the country that actually tailor that their, whether it's the healthcare parts or things that have to do with, living situation, insurance, all this kind of stuff. There's nothing to really help these young adults as they're trying to manage all of these other stressors and trying to find adult providers, for example. And there's some areas and specialties that do this a little bit better, but we could all really do a better job. And so again, my interest being, I would love to be able to change the narrative on this and have some more resources available to our patients with pain so that they can have kind of a smoother transition from pediatric to adult healthcare, as well as develop the resilience-focused coping strategies. So I first started by developing a model with my mentors who are on my K-23. And to give you context, I submitted my K-23, got a pretty good score, but needed to resubmit and wrote this paper in between. So it kind of helped build my case for it, and then it finally got funded on the second try. But I wanted to review the literature, like what is even out there that's looking at pain resilience in this population. And this multi-domain part is what I wanted to talk more about with you when I had mentioned that resilience is not just psychological. There are social factors, biological factors, and health and lifestyle factors. And some of these things could look like, let's say in the social domain, the influence of family and peers and social support, biological factors like genetics, hormones, and even things like the health of our different systems, like cardiovascular system, and then health and lifestyle factors like sleep and exercise. And all of these things likely interact to create this kind of multi-domain pain resilience profile. And in the context of the lifespan, as you see here, we have these kind of within the individual, but everyone is also, of course, influenced by historical factors like a pandemic, sociocultural factors, and environmental factors as well. So the hope is to take all of this into account to better understand what leads to healthy pain adaptation. So improved quality of life, increased functioning, and a reduction in pain. So this is where my K-23 comes into play, which we just started. And it's called the Study of Healthy Adaptation and Resilience to Pain in Emerging Adulthood, or SHARP. We're recruiting late adolescents and young adults, ages 16 to 21, both with and without chronic musculoskeletal pain and one of their parents or caregivers. We want to answer the questions broadly of what does this MDPR profile look like in this population? Are these profiles valid and stable in those with and without chronic pain? And do they help us predict pain and functioning over time in those who do have pain? So the first aim is to characterize the nature and stability of what these multi-domain pain resilience profiles look like. Again, focusing on, this is just kind of an example of some of the variables we're measuring, but across, again, these important domains of psychological, social, biological, and health and lifestyle factors. Of course, being a K, we can't be too exhaustive with what we can measure, but we're trying. And then second aim is to determine the extent to which these profiles are associated with pain, functioning, and what we call pain modulatory capacity outcomes, which I'll talk about briefly. But first, of course, just asking about their pain experience, retrospective report, as well as while they are with us during the visit. And how we do this is we have them complete a functional task called the 6-minute walk test, basically just walking on a flat surface for 6 minutes, and we measure the distance that they are able to walk. And at the end, we ask for a pain rating. So this is different from, again, that retrospective, like how much pain have you had, to how much pain are you in right now, especially after you've just completed this physical task. And then finally, pain modulatory capacity outcomes. And what that really means is our bodies have this internal way of regulating pain. So our brain and spinal cord talk to each other, and certain things make pain feel worse and other things make pain feel less. And so in this case, what we're doing is what we call kind of pain inhibiting pain. So we're applying pressure to one side of the body, and then we're having individuals place their hand in really cold water. And the kind of thought behind this is individuals who have a healthy pain modulatory system, this pain from the pressure will feel less as a result of putting your hand in cold water. Evidence shows that individuals with chronic pain don't show that inhibition of pain, and so it's a good indicator that chronic pain might be also related to some of these internal mechanisms not working in kind of the typical fashion. And finally, we want to examine the extent to which these profiles predict pain and functioning over 14 days and at 6 months follow-up. And this is to establish predictive utility of these profiles over time. So patients with pain will be wearing or have been wearing smartwatches, and this is, of course, to measure physical activity as well as sleep. And they receive text message surveys through REDCap where they can just rate their pain 3 times a day from 0 to 10. We're getting, again, that real-time data as well. So, of course, my hope is to use this information to develop strengths-based pain prevention and intervention approaches that are tailored to the unique needs of adolescents and young adults. Hopefully that could be an R01 application one day. But also the broader goal for me is to create and, again, evaluate programs that facilitate transition from pediatric to adult pain management services and really help individuals have better access to healthcare in general in this population. And then, of course, to be able to extend this to other populations in need, such as those with other chronic illnesses, or even extending it to younger patients and their families. So I'd like to just acknowledge my mentors on my K-23, and I came from the University of Florida, so I was able to luckily keep some of my mentors from there and have added as well once I transferred to Nemours for my first job. And I'd also like to thank my funding source, was the NIC HD, and the research staff here at Nemours.